It's time to enhance the relationship between expertise and impact, between knowledge and application. Welcome to a journey of discovery and empowerment. Welcome to All Physicians Lead, the Forbes Books podcast that highlights the critical leadership role that all practicing physicians take on every day. Here's Dr. Leon Morse.
Dr. Kevin Poe joins me today. I recently was honored to be on his podcast, and now he's here to share his work and his thoughts on physician leadership. There's probably very few listeners who don't know his story, but if you're not already familiar, Kevin is a practicing internal medicine physician and the founder of KevinMD. Most of us have heard about one of the most influential social media platforms in healthcare.
Leon, thank you so much for having me. It's an honor.
This is funny because I sort of feel like an amateur guitarist in the studio with Keith Richards here. So, correct me, teach me. I know you do that well as well, but we really appreciate you taking the time.
Well, thank you so much for having me. Excited to have a great discussion on leadership.
Excellent, excellent. We love to start off with the story. Your personal story. How'd you get started? How'd you get interested in medicine? Where did that take you early on in the educational and training journey?
I always like to say that my digital journey started when I was within my first few years. I discovered the power of blogs, and we'll certainly talk about that later on. And I think that really started my interest, that intertwining between clinical medicine and what I do online. I remember one day I was talking to a patient in the exam room. I remember writing a blog post, and she said, "I read your blog post this morning and I was comforted by what you had to say." And really, that was the genesis of what I do online. And it certainly evolved to a point where I still, like I said, practice 3 days a week, but just as important is my presence online and what I do with podcasts and on KevinMD and guiding patients through this whole digital landscape as it intersects with their healthcare. And it's a tremendously exciting and inspiring journey.
Yeah, you talk about that intersection, and it permeates everything we do now. We just started introducing an ambient dictation system to build notes, and the speed at which this is changing how we practice every day is incredible. How have you experienced that in your personal practice? And congratulations on seeing patients.
Oh, thank you very much. So I think that this recent AI boom is just one in the latest of digital disruptions that we have in healthcare. We always talk about the last 20 years. What are some of the big disruptions? Number one, of course, is the electronic medical records. Number two is things like social media and patient empowerment platforms where patients have so many tools that didn't used to be available to them, where they could research their own information. And now, over the last 3 to 5 years, we have the AI boom. And you mentioned things like ambient AI scribes, and that's just a start. It's kind of like the Wild West right now. There are so many AI health startups that are jockeying for position, and I think just recently, OpenAI just introduced ChatGPT Health, and that's another
Yes.
big thing that is going to disrupt our healthcare industry. And it's just a lot of fun, and I think it's a lot of responsibility as physicians that we need to help not only ourselves navigate this environment, but guiding our patients through this environment as well.
Well, it's interesting you say that because just this morning on WTOP, and I missed the introduction, so I don't know exactly what her role is with ChatGPT Health, but they were interviewing an executive about that system and the privacy aspects and how it's boxed from ChatGPT at large. You and I probably both know that access to healthcare is can be challenging, can be complicated. Everything from getting an appointment to getting pre-authorization for some of the things that we do. Once something as disruptive as ChatGPT Health, for instance, comes into play, and patients can access that so much easier than they can access their, you know, community neurosurgeon, for instance. How do you see us as clinicians putting a little bit of brakes on people making medical decisions based on this nascent technology? And should we be advocates one way or the other?
Well, I think that whether we like it or not, it's going to happen anyway. And I see a lot of similarities to Google when it first came out,
Yep.
and patients Googling their symptoms, and we call it Dr. Google. And
Mhm.
we, as physicians, initially saw it more of a pejorative term, don't use Dr. Google. But I think the issue that we need to learn from is that patients are going to do it anyway, whether we approve of it or not. And we can give a lot of caveats saying that AI has a lot of hallucinations and we have to be careful with how these AI companies are using patient information. But whether we approve of it or not, patients are going to use AI to help interpret their symptoms and diagnose and give treatment options, whether we as the physician community like it or not. It's the same for Google.
Certainly.
Like, you can't
Yeah.
tell patients not to Google their diagnoses online. So we need to expect it to happen. I do think that we need to embrace it. And rather than, again, being in a paternalistic framework where we tell patients what not to do and or do, I think that we need to partner with patients and let patients know, come with whatever you find on ChatGPT or Google Gemini or these other large language models. Come with that information, and we could discuss it in the exam room. And I will partner with you, and I will tell you what I think, and I will give you my guidelines and general approach. But the ultimate decision, of course, is yours. And I think that the physicians who embrace AI eventually is going to replace the physicians who don't. I always say that to answer that question, is AI ever going to replace physicians? And I always respond, not necessarily, but the physicians who embrace AI and accept AI in healthcare are eventually going to replace physicians who don't. And like I said, with things like Dr. Google, I think that now patients embracing AI is going to be that next issue that we're going to deal with.
Yeah. And I've felt that, age helps with a lot of things, right? But certainly one of them is the maturity and the thicker skin when somebody comes in and says, "Well, you said this, but I read this online." When that first started happening, when the internet was very, very new back when I was practicing as a young neurosurgeon, folks would come in with, a stack of the, printouts, folding sheets of prose that was just printed out on a dot matrix printer.
Mhm.
And the initial response was not great, didn't feel good for me. But the older you get, like you said, it becomes easier to embrace that. And, think of it like a second opinion. We always encourage patients to get a second opinion, particularly with major decisions about their health. So I've started to look at these over the last, 10 or 15 years as, okay, well, you got that opinion. Here's my opinion. And like you said, we have a discussion and ultimately they have autonomy and they make a decision. So
No, I
great,
completely agree. And then
great
also as a
advice.
medical community, I think that we've kind of brought it upon ourselves because it's so difficult now to see a neurosurgeon like yourself or even to see a primary care doctor like me. Sometimes it takes a year for a patient to book a physical with me. And I cannot blame them if they want to go elsewhere with better access. So, as a medical community, we can't tell patients not to go online and do their own research when we as a medical community cannot grant patients the access they need.
Indeed. Indeed. One of the things I thought about when having you on is that you obviously talk to a ton of people. You give people a voice. I am very grateful that you allowed me to join you on previous podcasts. How often do you get to talk about you or like we're doing today?
I would say it's in the minority, but it's something I did definitely enjoy doing because on my own show and on my own podcast, the podcast by KevinMD, I always like to shine that spotlight on the guest because I always say that generally guests have a more interesting personality than I do, and people tune in
I might take an
most likely to
issue
hear
with that.
my guests to because they don't want to hear me drone on. So to answer your question, I generally love talking to guests. I learn a tremendous amount from my guests, and I always say, rarely do I get the opportunity to have someone like yourself as a guest. I have about 15 minutes of their time, and I could pretty much ask anything I want. So for me, it's a fantastic learning opportunity. But it's always a pleasure for me to be on the other side of the microphone and be on a podcast and do a little bit more talking, and it's definitely a refreshing change.
Well, we certainly appreciate it, and I have enjoyed so far and will continue to do so. Still practicing medicine, you look at all the things that you do, and I have to ask, there was an old movie with Michael Keaton that he cloned himself, and each iteration was not quite as good as the other. If we look at all the things you do, they're all great. So how do you do that? Do you not sleep? You don't take weekends off? You're still seeing a full clinic 3 days a week and doing all of this outreach education for patients and physicians. How do you pull that all together? What advice do you have for others?
Well, number one, and it's a cliche, you got to love what you're doing. You can't do what I'm doing without loving what you're doing. So I love seeing patients. I do love primary care, but I only work, 0.5 FTE primary care. If I were a full-time primary care doctor, maybe my lens would be a little bit less rose-colored, right? I love what I'm doing with my podcast. I love with KevinMD. I like having that platform. I love reading the stories that physicians and other people within the healthcare system, and it's not just physicians, by the way, it's nurses and patients, and I get to hear stories from each of their own corner of the healthcare system, and I like to shine a spotlight. And one of the most gratifying things is that when people write a story on Kevin MD and it leads to something positive for that author, and it could be connecting with like-minded folks, or having the author say, I wrote that article on Kevin MD, and then all these other doctors responded saying, you know what, I'm going through the same thing too. Or if they write an article, Kevin MD, and a newspaper producer or a television producer comes up to them and say, I want to share your story on a more larger platform, and using Kevin MD as that jumping off point, and just having something positive come from whatever they write on Kevin MD, to me, is very gratifying. So number one, you got to love what you're doing. I do love what I'm doing. And number two, it gives me the opportunity to um to be a better family person, right? I have two daughters, one in college, one in high school, and then it gives me more time to spend with them and my wife as well. So having the opportunity where I don't have to be in clinical medicine full time, and giving me that space and freedom so I can be a better father and husband, also fuels what I do as well. So I don't want my identity to be purely a physician or Kevin MD. I want my identity to be those things plus a father and a husband as well. And actually being a father husband, to me, is the most important part of my identity. And what I do with Kevin MD and what I do with clinical medicine only helps perpetuate that.
Yeah, well, kudos to you. That's a great frame. And I will reflect some of that gratitude back to you, because I've had a half a dozen folks approach me with interest in physician leadership development, saying, "Oh, I heard your podcast on Kevin's podcast, and we really should talk about advancing physician leadership development." So I have definitely experienced exactly what you described. So thank you again. So you're humble enough, and I'm sure you'll probably say, "Oh, I'm not really," but you are a leader. You're a voice. You probably, hopefully, come to internalize that and recognize how powerful that is. At what point, as you started, your first blog, and you said, "Well, I just am writing this because I like to write," did that transition in your mind, saying, "Oh, wow, I have a very powerful voice, and there are certain guardrails that you come up with, certain directions that I want to push this because of the influence that I've recognized that I've had."
I can think of two events, right? Number one is on kevinmd.com itself, when I just would get a continual influx of submissions. And there are a lot of themes to those submissions. Number one, of course, is physician burnout. I get a lot of articles talking about stories where physicians are burned out from what they do. I got a lot of submissions, especially during the COVID pandemic, and how we as a healthcare system was really struggling during the initial stages of that pandemic. And sometimes there were a lot of stories that weren't necessarily published in mainstream media platforms that physicians and other healthcare professionals would share on Kevin MD. So that's when I realized that my platform could be that voice for people in our healthcare system that could be unheard, right? And the second time I realized that the KevinMD platform can assume that leadership position is when I started my podcast. I started my podcast at the beginning of the pandemic because I was partially furloughed and I had a lot of time on my hands. And I always wanted to start a podcast, but I didn't really quite know how to do that. I know that there were podcasts I wanted to model mine afterwards. And I remember sending a bulk email to my mailing list of all the authors. And we're talking about, I have 5,000 authors. So I have them on a mailing list. And I emailed them and I said, I'm starting a podcast. Are you interested in being on my podcast? And just go on this link where they could schedule on my podcast. So I had maybe like 100 slots during the summer where I would interview people. So I would send that email out, and I'm not joking. Within that day, all 100 slots were filled.
I bet. Yeah.
All 100 slots were filled, and then I sat back and I thought back. I goes, oh my gosh, what did I get myself into? Right now, I gotta see this too, because not
It's a
only
good thing it wasn't open-ended,
I
right?
know
I mean, you could
exactly.
limit it to those 100 or you'd have
I
24 hours
know.
a day for 6 months.
And then I thought to myself, I have no idea how to start a podcast. I don't know how to interview people, but I got 100 podcasts lined up, right? And that's when I realized that
Just
not only
before
can
ChatGPT, right?
I
You
know
go to
exactly, and then okay, I really stepped in it now. I'm really committed to it now. So that's when I realized that the platform could extend to the podcast, where I think just people just really need a place where they can share their stories and have their voice heard, right? And that's what it comes down to. We as physicians, we want to be heard, and sometimes in our healthcare system, we don't have the megaphone, we don't have the platform where we could share their stories, be heard, and make a difference not only for our lives but for the lives of our patients as well.
Yeah, fundamental tenet of leadership, right? You want people to feel like they're heard. You actually want them to be heard, not just feel like they're heard. And you get such greater buy-in for any vision that you're trying to work toward if people really feel like they have a voice. So again, kudos to you for that. Was there anything that surprised you when you opened this up, both in writing and on the podcast, about how open people became once you created this space that seemed safe, probably?
I guess I was surprised by some of the pieces were very vulnerable, right? As physicians, we are trained not to show vulnerability all
Yeah.
through training and medical school. That vulnerability is like stamped out of us, right? But now you have all these physicians talk about behavioral health issues. They talk about how suicide affect them. They talk about managing their family and managing issues with their children, and how do other physicians do that. So what surprised me is that just like everyone else, physicians are vulnerable too. Physicians are going through a lot of the same issues that their patients are going on too. Like, physicians are no longer on this pedestal where they can do no wrong. And really reading a lot of these articles and having physicians share their vulnerability. And then not only that, having other physicians chime in and saying, you know what? I'm going through the same thing. You're not going through this alone. That to me was surprising, but also empowering as well, because that's really the only way that we can make changes to really not be afraid to be vulnerable, and and just let those who make decisions say that, hey, we need to fix the system, because if physicians are retiring early or leaving medicine entirely because they're burned out because of all these issues, then patients are going to suffer too.
Yeah, that doesn't do anything good for that access question that we had spoken about earlier, right? We need as many folks taking care of patients as we can keep. So social media writ large, as physicians decide, hey, I'm going to create a presence here. Some of the things that you learn, maybe some of the things that you've seen other doctors do that could have been done better. What are some of the opportunities? What are some of the things that you advise folks who are getting into that space in whatever platform they choose to keep it appropriately professional, but also approachable? There's a balance there, right?
Absolutely. And typically, I give kind of three reasons why physicians should consider going online. Number one, of course, is things like on a reputation. Patients are Googling their doctors online. A lot of times when patients see me for the first time in the exam room, they know more about me than I do about them because of my online presence. So you have all these doctor rating sites that give doctors an online presence already, whether they want one or not. So it's important for physicians to proactively define themselves online, have some type of social media presence. It could be something simple on LinkedIn or Doximity where they just could put their resume on, and now there's so many opportunities for us to create that online presence. Basically, we want to control how we look online. Number two, of course, is um, correcting misinformation. And I think that that is a huge part because if physicians aren't online creating that reputable health content, someone else is going to do it. And now there's really no guardrails in terms of who can create medical information online. There's a little bit of equivalency between someone who has been trained in medical school versus someone who literally can write about health information just off the cuff with zero medical training, but that information gets that false equivalency online. And if trained physicians aren't on that platform, you just have people with zero medical training, influencers, and go on sites like TikTok and they could push health information and they would have tremendous influence. So I think that we as physicians, we need to create that counter narrative of reputable health information, especially today when health information not only can be inaccurate, it's also politicized as well based on what you believe politically. So it's important for us in healthcare to really promote evidence-based, reputable health information. And the third reason why I think more physicians need to be online, of course, is the advocacy piece. And we touched upon this earlier. There's a lot of forces that makes life for physicians more difficult than it should be. And more importantly, it makes how physicians care for patients more difficult than it should be. So I think that we need to go online to advocate on behalf of our patients because no matter how hard it is for us, no matter how hard medicine it is for us, our healthcare system is even more difficult for our patients. And it's important for us, of course, to advocate for patients. And the best way to do so is online, creating content, writing articles on and op-eds on the newspaper, appearing on television show, creating that content that we really want the best for our patients, even though our healthcare system is working against us.
Yeah. Yeah. And as you're doing all that, you talk about balancing the content that's out there, some more credible than others. How do you make sure that, your brand, your platform has that very high level of credibility so that people can say, look, if you really want solid information, here's where you go. And, how do other physicians online, is that, and I don't want to be too pejorative here, Leon being his authentic self and, riding a skateboard around a skate park while giving medical advice. That might appeal to some folks, but do, crazy things like that that might get you more followers help your brand or tarnish your brand, you think?
So it depends on the personality. There are a lot of wonderful physicians who do similar stunts like that. And I think that you have to be authentic, right? So I think that you need to balance that authenticity because you're right. If a physician does something that, sings a song, does a skit, and like you said in your example, does something on a skateboard, it gives medical advice. As long as that advice is reputable and that physician is trained, sometimes doing off the cuff stuff like that, spontaneous stuff like that is going to connect with some patients. And I think that's
Sure.
tremendously important. For me, I'm a little bit more of a serious guy, so I probably don't you won't see me singing songs or rapping or anything like that. So I do so in my own way that fits my personality. And for me is just having that platform and vetting some of the articles that that are submitted to me, making sure that they are reputable information. Now, that doesn't mean a uniformity in opinion. People can have different opinions that I may not agree with, that
Sure.
but are certainly valid. But as long as I think that factually the information holds up, and as a trained board certified physician, hopefully I have the credibility to do that. And of course, talking to them in person on my own podcast, where I can ask them questions to flesh out their viewpoints and articles, and they could share their story in their own words. So every physician um, can choose a platform in a way that best suits their strengths and their personalities. And the good news is that today, with social media and the tools that are available to us, there's this pretty much every single way that fits every single personality and every single strength that a physician has, whether it's through written content or through video or through singing or through poetry or through podcasts. There is a medium out there that fits every strength or every personality that a physician has.
Yeah, I'm looking forward to having AI make me look like Brad Pitt for future iterations of this and see if I get more followers. I don't know. Um, any criticism that you faced early on as you were building this? I mean, particularly from other doctors, did people come to you and go, what are you doing? You're a doctor. Why are you doing these crazy things?
I think at first, and I've been doing this for almost 25 years now. So when I started being more present online, this was in the early 2000s. And at that time, a lot of doctors didn't quite know what to make of being online. They felt that doctors should stay in their lane, just stay in the exam room or in the hospital or in the OR. And, why do you need to be so well known? And this was before patients would Google their symptoms online, or patients would research their doctors online.
Yeah.
So yeah, I think at first there are a lot of doctors that said, "Why are you doing this?" But I think over the past decade or so, I don't think it's optional anymore. I do think that we have a responsibility to go online and do some of the things that we talked about earlier. I think another criticism that I had earlier is that because I don't have any training in running a large platform, or running some type of site that publishes articles. So yeah, there were times, especially in the comment section, where it will get unruly. As you know, with any type of comment section that's unmoderated, it could eventually devolve into shouting matches,
Sure.
anything that could be remotely political. You're just going to have people arguing with each other. So I think managing that sometimes would be difficult. And then there were some articles that you want to balance, and we talked about that balance about being online, right? So I think there is a distinction between privacy and secrecy, right? So I think privacy, of course, when it comes to patient privacy, that is of utmost importance. We have
Yeah.
HIPAA. Whatever is posted online, we have to be absolutely respectful of our patient privacy. And then you contrast that with secrecy, meaning that we want to shed light on some aspects of our healthcare system that isn't really mentioned in mainstream media. We want to talk about some of the hidden things that our medical institutions are covering up. We talk about things like physician suicide and and patient violence against healthcare workers. Those are two things that a lot of hospitals aren't really willing to
Yeah.
publicize. If it
Don't want
happens
to talk
to the
about.
incident,
Yeah.
you don't want to talk about that, right? So secrecy is something that I think that we do need to expose on social media, but we have to balance that with the privacy of our patients. And sometimes that's a fine needle to thread.
Yeah. On the flip side, those are some of the criticisms, but over the years, two or three or four of your favorite moments, the most compelling experiences that you've had doing this or that people have shared with you, what do those look like?
Um, I think I mentioned earlier, whenever an author or someone on my podcast,
Yeah.
they'll say KevinMD would expose them to a larger audience or give them an opportunity that they would have had. That to me is the most gratifying. Um, I think just having um, people ordinarily that I wouldn't get a chance to talk to. You have famous authors come on and are willing to be on my show where I could talk about them and be able to learn from them and have my audience learn from them. That to me is very gratifying. And then having something on my site make effective change. I
Mm,
think
sure.
if someone talks about physician burnout and a healthcare administrator comes up to me and say, I listened to this podcast. I didn't realize this particular perspective from one of your guests, and now I'll take that under consideration when I um, suggest changes in my own medical institution. That to me is very gratifying because we could publicize all we want, but if it doesn't make positive change for physicians and our patients, really, what's the point, right? So I think that anytime where my platform can play a small role in affecting positive change, that to me is one of the most gratifying things of why I do what I do.
Yeah, and ultimately, I've said this many times before, but when I've held leadership positions, on the back of the door coming into my office, I would always have a sheet of butcher block paper, and it would be blank except for a big hand-drawn arrow, and that arrow points to better patient health. And I said, no matter what you're coming to ask me, if you want to build a new hospital or you want a new MRI scanner or you want to hire more staff, tell me how it gets to better patient health. And so if I'm hearing you right, those things that you find most appealing are folks who are trying to contribute to overall better patient health, or specific things that you have put out there that have established change that ultimately ends up with better patient outcomes. And that's really admirable.
Absolutely. I think that whenever physicians want change, it can't be about themselves, right?
Yeah.
It always has to be, how does this change improve the lives of our patients? Because I go back to what I said before, no matter how hard we have it as physicians, let's face it, in society, we are a pretty privileged group, right?
Yeah,
Overall,
for sure.
if you take it into perspective, no matter how hard things are for us, our patients have it harder in our healthcare system. We have a very labyrinthine healthcare system in the United States. A lot of my patients every day I talk to about, or they talk to me about how expensive healthcare is, how expensive drugs is, how difficult it is to see a specialist. And you hear these stories and then you realize that you're in a privileged position, that you can help them out, because as physicians we can help patients when they're facing these desperate health situations. So we need to realize that we need to frame whatever issues we have, whatever complaints or difficulties that we face. It has to be framed in a way of how solving those difficulties can improve the lives of our patients.
Yeah. Yeah, yeah. One of the things that I emphasize to folks quite frequently, you talk about restoring your joy in medicine. There's always going to be this overhead that is, a lot of people call it, that you've got the EMR, and, you've got billing and coding, and you've got administrative requirements and training requirements, and those are going to be there. But it's very easy for us to lose sight of the fact that we have tremendous impact on patients, as you suggested. And because we do it so routinely, we can become sort of inured to the fact that you're changing potentially dozens of people's lives daily, with whatever interventions, mechanisms we influence them. And so trying to get folks to refocus on that privilege that we have to be able to help patients and their families through difficult situations. I mean, people rarely come to a doctor because they want to say hi, right? There's something going on, often, that they're worried about, and um, and a lot of, I think, restoring that joy in medicine is being able to see that not just as transactional, but yet as an incredible privilege to share their deepest, darkest secrets and help them work through it.
Yeah, 100% agree. I love that you use that word privilege, because it is a privilege to be in a position where we could just make such profound changes, hopefully for the better, but profound changes in our patients' lives. And I can't think of any other profession that makes as much of a change in
Yeah,
anyone else's lives.
yeah, yeah. There's I don't want to throw out a bankruptcy analogy that has anything to do with either you or me or anything we do. But the old saying is, how did you go bankrupt? Well, slowly and then suddenly. As you were growing this influence system really that you have now, I mean, were there times where you mentioned earlier one of them where you're like, oh my gosh, now I got 100 guests that I need to manage. Other instances where you thought, wow, this is out of control. This is growing faster than I can manage it. Was it sort of a hockey stick? Were there areas where you said, okay, I need to cut back? How did you manage that growth over the decades? And
So I don't think that there was any point where there was like an exponential growth. Like maybe that time with the podcast, but that was my own doing. But I think that
should
in
have
terms
should have put up 10 slots, right?
I know exactly. So that was my own fault. But in terms of the trajectory, I think it's been slow and steady. Like I said, I've been doing this for almost like 20, whatever, 23, 24 years now. And it's been a slow growing trajectory. There's been ebbs and flows, especially during the pandemic where people would go online, especially in the first days of the pandemic, and they didn't quite know what was going on. I remember there were some physicians who wrote some perspectives on my site, and those pieces exploded, literally millions and millions of views, repeatedly took my site down. But um, I think that outside of major events like that, the growth has been slow and steady. I think that more and more medical students, they've grown up online on social media, and they know Kevin MD, they know who I am. And a lot of medical schools actually assign their medical students to write op-eds, and then as part of their assignment and part of the
Mm.
grade, they have to
Oh,
submit it
wow.
on Kevin MD so they could get published, right? So the point is, a lot of those medical students, interns, and residents now are attending physicians, right? And they've grown up on Kevin MD, and they know the power of the platform, and they know the power of being heard, and they know that there's always going to be a safe space if they ever want to share their story, and there's always going to be a place for them on Kevin MD where a board certified physician like myself, and it's only me, is going to be the one deciding whether your article gets published or not. And like I said, it's a safe space where I think physicians can control the narrative on my site.
So you mentioned the pandemic, and there are moments in time that we sort of use as markers in our lives. So now we're post-pandemic. During that time frame, I have a number of things where certain episodes are just sort of seared into my consciousness, either in your practice as a physician or uh, with your platform. Some of the things that really stick in your mind in that pandemic timeframe, stories uh, that are seared into your memory.
So personally, I I don't have, compared to the other physicians that were on the front lines, I can't really compare because I was seeing patients virtually. I wasn't on the front lines. But some of the stories that I hear, especially on those early weeks where people didn't quite know what they're dealing with, and you had physicians getting sick from this then mysterious illness, dying. You have patients intubated, ventilated, and the only way that it can say goodbye to their family is through these iPads, and people were just dying by the millions. And um, a lot of the stories and a lot of the podcasts I talked to the doctors during that time, they were just tremendously heartbreaking, some of the stories that they share. So, um, those stories are definitely seared in my mind. So, like, certainly nothing personal that I face. I was very fortunate, to have my family. We made it through the pandemic, but a lot of other physician families weren't as fortunate, right? They had to show up for work. They had to work in the emergency departments. They had to work in the ICUs. They had to fight the shortages of personal protective equipment, right? And, they had to ration, respirators and masks and during those early days. And those are the stories, especially those first few months before we had that vaccine. Those are the stories that, when I hear them, I'll never forget some of the stories that I've heard and some of the articles that I've read and the people I've interviewed on my podcast.
Yeah. I'll be dating myself here a little bit, but I remember, the first case I did during that time frame and a COVID positive baby. And I was in this, almost NASA suit. I looked like the old movie Andromeda Strain where, you just don't know how it's going to go. And, the unknown is really hard. Initially, um, I have some military experience. So I thought this is kind of what it's like being in a combat zone, in a war zone, because you're putting yourself at risk. And as I thought more about it, I realized there were two very, very significant differences in that, in our country, at least, people who go into a combat zone have volunteered for it knowingly putting themselves at risk. And while, there are diseases that you could potentially catch in healthcare, you don't go into healthcare thinking my life is at risk going to work. And people were in that position. And that's a very, very different mindset than I volunteered to be an Army Ranger. So I'm in. Um, and then the second is, when we're also fortunate to have a couple oceans on either side of us. So an invasion of our country is, super, super, super unlikely. So our troops go somewhere else and occasionally, unfortunately, sometimes get injured or killed, but it doesn't put their family at direct risk. Um, but, so many of our colleagues would like live in their basement during this period of time because they didn't want to go near their family members, appropriately so. So just two additional big psychological levels of fear and risk. And what was most amazing to see is everybody pulling together from, physicians, nurses, techs, administrators, the entire healthcare system, ecosystem, doing just amazing things under such an unknown level of fear and stress.
Yeah, and that was tremendously inspiring. Like they said, everyone banding together for that common goal. We rarely have that in healthcare, right? And you had even the public, cheering healthcare workers. You had these kind of um, a unified front against kind of a common opponent, and I haven't seen that before. And you brought up that story about sleeping in separate rooms, and I had heard stories, of course, similarly, where a physician had to go to work in the emergency department, come back home, and go through a separate door and
Yeah.
shower, and really there was a lot of uncertainty that they had in terms of spreading it to their spouse or their children. And like you said, this is just kind of another level of threat, not only to themselves, but to their families as well, especially during those early days.
It's interesting too. I don't know if anyone studied this, but as we were talking about that, I wonder if that might have changed the psychology for physicians in particular about being more vulnerable, admitting more vulnerable, when you've reached sort of that level of fear and shared it potentially, and then found that that is useful to share your feelings. We talked earlier about how that's not how we're trained, right?
Yeah.
Um, it's an interesting thought.
No,
As we
I
were
think
going
so.
through that, I'm
I think
thinking
so.
out loud here.
No, I definitely think it was a catalyst for some physicians to share some vulnerability there because so like you said, you bring up the military analogy, right? When soldiers volunteer for the military and go off overseas to fight, they go in knowing that their life could be at risk, right?
Right.
I like to posit that the majority of physicians don't go to medicine knowing that their lives are going to be at risk.
Assuming that
Right,
that's a
yeah.
huge risk. Yeah,
Yeah,
exactly.
so I think that, COVID really brought that home and really, made physicians question, some of the reasons why they went to medicine. Are they willing to die for your profession, right? And, that's probably not something that they thought about as they were training.
Yeah. We're way beyond the era where, healthcare providers would walk around with masks during the plague or, the last massive pandemic in the, early 1900s. So you don't think about that when you're applying to medical school, I don't think. Now you might,
Yeah.
but I didn't.
Yeah, absolutely.
I certainly didn't. Um, you obviously set a very high standard for professionalism. So you mentioned earlier that your patients will sometimes come in and say, "Oh, I've seen you, heard you, listened to you," and enhances your respect and influence. How should physicians who are doing this social platform, I mean, whether it's related to their profession or not, think about the fact that, your patients are going to see you? And what does that do to your ability to, as we talk about with leadership, influence behavior to achieve a desired result? If you have a high degree of credibility, one would presume that patients are more likely to take your advice and make changes that improve their health. If your credibility is somehow threatened one way or another, potentially by things that you have online, what does that mean? And when should doctors in training, student doctors, start thinking about managing their social media presence to enhance that credibility?
Yeah. So to answer your first question in terms um, of the credibility physicians have online. So I think that they need to ask themselves why they want to be online in the first place. I think too many physicians are online because someone told them to be online. You have to do this and you have to create all this content. So you need to ask yourself the question, why do I be online? Do I want to be online to enhance my online reputation? Do I want to be online to create reputable health content and correct misinformation? Or do I want to be online to advocate for a specific issue or on behalf of our patients and or physicians? So once you have that reason, then the the goal becomes much more clear, and then you could adopt those tools and strategies to achieve that goal. But start with the reason why. Why do you want to be online first? And then you have so many tools to accomplish that goal.
Yeah.
Your second question in terms of students and young physicians. So the answer is now, right? So I think whenever a student decides to pursue a career in medicine, whatever they have online is going to be heavily scrutinized, not just by medical schools when you're applying, but also hospital credentialing committees, and probably most
All right.
importantly, your patients, right? So I think if your patients Google you and you have all this stuff that you've done in the past that isn't really congruent with what it means to be a physician, that's probably something that you may want to reconsider, right? So students need to take online professionalism tremendously seriously, not because it's going to harm your own reputation, but I think that you have to think about your future patients as well, because especially now, before, like we said, we had Google, now we have AI, and where does AI get all that information from? It sucks it up from the web. So I think that physicians and future physicians have a responsibility to create reputable health content online, because your future patients will be reading that information. So you have to start now to clean that up.
Yeah, it's funny. Back in the day, I used to, when patients would occasionally come in and say, "Oh, I've heard good things about you," I would say, "Is my mom calling the hospital
Yeah.
again?" But now, they'll say that and I go, "Oh, did Google actually say something nice about
Yeah.
me?" So it's a very different environment. Gonna be respectful of your time. A little bit of a wrap up. We've covered a lot of territory here. Thank you again for your insights. Any closing comments, or compile all of this to give advice to our listeners?
So I want to go back to the privilege point that we talked about earlier.
No.
We talk a lot about physician burnout on my podcast and the site, and there are a lot of difficulties that physicians have today in our healthcare system. But I think that we need to remind ourselves that it is a privilege to practice medicine, and it is a privilege to have that influence and impact on our patients. So just remember that no matter how hard it is for us as a medical profession today, and we do have a lot of obstacles, go in trying to solve those obstacles on behalf of the patients and the privilege that we have in treating them and positively impacting their lives.
That's awesome. Well, great wrap up. Kevin, thank you very much for taking the time, and we will pay close attention to what you're putting out there, of course.
Thank you so much for having me. It was a pleasure.
This has been All Physicians Lead. We can all be better leaders, and our teammates and patients will be the beneficiaries. Go to allphysicianslead.com to unlock your potential, sharpen your impact, and elevate your journey. All Physicians Lead with Dr. Leon Morse is a production of Forbes Books.